Dear readers and viewers, we have with us today a dedicated physician who embodies a commitment to comprehensive patient care. Dr. Taher Chugh is the medical director of the Toronto Concussion Clinic and also bring his expertise to the Institute for Behavioural and Functional Medicine. With a background in family medicine, sports medicine, and psychotherapy, Dr. Chugh's approach focuses on empowering individuals to achieve healthier lives. His dedication to thinking outside the box to improve patient well being makes his insights particularly valuable. Welcome, Dr. Chugh, to Magazika.
Thanks for having me, Suman.
Thank. So, you have dedicated a significant part of your career, understanding and treating concussion. For our readers, who are mostly common people, may not know much about it. So, could you explain it in simple terms what a concussion is and why it's so important to take it seriously?
So, basically, our brains, they work in networks. So anything you do it with various parts of your brain that work in cooperation with each other. And so, when you have a concussion, part of that network gets stunned and kind of goes offline. And so you can't do things the way you used to do them before. And the treatment is really geared towards getting those circuits back online to get you functioning the way you'd like to be functioning again. Um, there's many conditions out there that are like that, actually. People think this is very novel and new, but even if you look at something as mundane as an ankle sprain, that's the way it's treated. It's if you look at the evidence, the best treatment is something called neuromuscular control training, which is 12 weeks of training you how to integrate different motor recruitment patterns, so different ways of firing muscles. So not just the how much you recruit them, but the timing in which you recruit them and how you coordinate them with different with your breathing and where you placing your attention and things like that. And that is what results in resolution of the problem. So it's training, right? So the whole focus of concussion is getting those networks to turn back on so that you can do what you want. And there's not a doctor can't really do that for you. You have to train it back.
Oh. So you serve as the medical director of Toronto Concussion Clinic. So over the course of time, what are some of the most common misconceptions you have seen, you have experienced firsthand that people have about concussions, and what would you want everyone to understand?
I think the first misconception is that post-concussion syndrome is a real diagnosis. So it
Oh,
hasn't been a real diagnosis for a long time now. That's from DSM-4. So it's been about 15 years now. It hasn't been used. OHIP still sticks to it, and insurance companies still stick to it, mostly because of red tape, I think. There's just some inertia in changing these types of things. But now it's called persistent concussion symptoms, which is not a diagnosis. It's
mm,
basically saying that you had a brain injury and now you have all these symptoms. And we have to discover what those diagnoses are, right? It's like a bag, an umbrella term, and you got to find out what the components are within this bag. And
okay.
so people get this idea that I need to get a concussion assessment, but you wouldn't go to a doctor and say, I need like a headache assessment and a fatigue assessment and a dizziness assessment and um, think of them as totally unrelated from one another, right? So I think
Mm,
that's a big misconception. And when people see it this way, it at first sometimes people feel a little bit overwhelmed, but after that, it gives them a lot of opportunity because when you treat it like post-concussion syndrome, they don't really know how to treat it. It's kind of like imagine you didn't know how to play baseball or what baseball was about, right? How would you
yeah,
play it if you didn't know it
yeah.
involved hitting a ball, passing a ball, catching a ball? You wouldn't be able to play it, right? So we got to break it down so we can treat it properly. So that's the first misconception I see. And then the second one is people are always looking for objective testing or objective evidence for their concussion, like an MRI or a CT scan or a blood test or something like that, right? Insurance companies are the same, lawyers, the legal system is the same. A lot of it is because these rules in the legal system were set back a long time ago, like 30, 40 years before we even knew what was going on, like, with concussions. So that's kind of stuck by tradition, but there isn't any simple diagnostic test or investigation that can diagnose this. It's a clinical diagnosis. And if you look at what I just said about breaking it up into all those different diagnoses, all of those conditions too are clinical diagnoses. Like you look at
Yes.
headache. Headache is almost always a clinical diagnosis. There's a compendium called the ICHD that we use to diagnose headaches, for example, right? Um, what's more important is like, say, for instance, someone has something called BPPV, like benign paroxysmal positional vertigo, post-concussion, and they're like a 30-year-old person that doesn't have a history of migraines, the chance of them having that condition, BPPV, is negligible unless they've had a concussion before. That's more telling, right?
Mm.
But no one considers that objective for some reason because they're so stuck on like there has to be an X-ray that shows something out of place or there has to be a blood test that's out of the range. So I think those are the two biggest misconceptions. And once people can identify them, it gives them a lot more insight into how to deal with their condition intuitively.
Mm. That's very good to know because the way you were explaining, it sounds so logical, but sometimes the whole outlook is kind of stuck in some traditional box or something.
Yes,
Something like that.
exactly.
Okay, so your background includes training in both sports medicine and psychotherapy.
Yeah.
How do these two seemingly different fields intersect when it comes to helping people or individuals recover from injuries and improve their overall health?
I don't see them as that different. I see them as two sides of the same coin.
Oh,
Like if you look at professional athletes, psychology is a big part of their training.
yes.
And what I've been focused on is functional rehabilitation. So trying to get people's performance more in line with what they want to see of themselves, right? Um, and so when we're treating back injuries, for example, right? We're going to break it down into the biomechanics and then we're going to teach them how to do those building blocks of movement so that they can use their bodies in a way that doesn't kind of injure themselves on an ongoing basis. But then a lot of people also have fear of doing these types of movements, and they have these preconceived notions of the consequences of this. And so training them to kind of relate to it on a different level psychologically also can be very instructive. I remember in medical school um, at Sunnybrook, this is back in like 2004 or 5, there was an orthopedic surgeon and he was giving a talk and he made a very good living taking care of people's backs, for example. And he had a clinic in New York and one in California and then one in Toronto. I forget his name now, but I remember being confused after about half an hour. And I remember asking, "Sir, are you a psychiatrist or are you an orthopedic surgeon?" And he chuckled and he said, "No, I'm an orthopedic surgeon, but there's a lot of psychology to this injury." Um, and you know, I can go into that in more detail, but basically I see them as two sides of the same coin. Like if someone has a disc herniation, for instance, on an MRI, that doesn't mean they're going to have any pain or disability. And then sometimes you'll find someone with an MRI that has nothing really significant in it, and they have a lot of disability and they have a lot of pain, right? Um, so there's other factors that explain it. And I think that goes back to what I was saying before about this misconception. A lot of people think that everything you'll see is on an X-ray or an MRI or in a blood test,
Mm,
but the way the brain works is on many more dimensions.
yeah. So suddenly, after hearing you, I just remember a quote I read somewhere that we human beings are not a body with a mind. We are basically a mind with a body. The mind is as important as the body is. So
Yeah,
that's how sometimes we have to take care of patients in both the angles, from the psychology perspective and the physiological perspective. It's
like
very
sorry, go ahead.
no, no, please go ahead.
Yeah, like I remember one time there was this post-concussion patient we were working with, a lady, and she had a lot of screen sensitivity. And there's a lot of research, there's a lot of physiology that goes into how to train people with respect to screen sensitivity. But she was already back at work, and so there's no way you can put things on pause and just work on those types of things. So I remember I just did a session with her, a solution-focused session, just geared towards getting her to explore other factors that may be within her purview and how she would play things and kind of getting her to think back to some of the strengths she had and how to leverage that in the face of these challenges. And within a week, she was able to improve her resilience in front of the screen exponentially, and I didn't even tell her what to do.
Wow.
She was just able to do that because she approached it differently on a psychological level. So uh, I've come to see the psychology of almost everything as being
Mm.
uh, fundamental.
No, that's a very inspiring incident. You have a strong commitment to addressing healthcare inequalities. Can you tell us more about the importance of accessible care, particularly in the areas of post-concussion syndrome and the related mental health?
Yeah, this is a really big question. I feel I can go in many directions, but I don't want to be too political. I guess I'll say that I'll just, with respect to persistent concussion symptoms, for example, there's very good guidelines out there. For example, the Ontario Neurotrauma Foundation guidelines. They're internationally reputable. And if you read them, it's really hard for patients here in Ontario to get that care. Um, or you take something like insomnia. Like there's a lot of buzz about it now in the media, right? About sleep issues. You
Yes.
get, the IT billionaire Bryce Johnson. He does like all this, you know, experiments with longevity, and you see him talk a lot about sleep. You hear it all over the place. And 10% of our population has insomnia. 40%
Oh,
have symptoms of
wow.
insomnia. And yet the everyone knows the gold standard for treating that is cognitive behavioral therapy for insomnia, CBTI. Yet most people have never heard of it. Doctors know that's what it is, but like that's the gold standard, but most patients haven't heard of it. Or most patients have been struggling with this and been getting sleeping pills and different types of medications for it, and their symptoms are still there, or the medications give just short-term relief. We know there's a good treatment out there for this. And so that's where my interest has been, is in providing people with these types of treatments that is focused on training their physiology so they don't need to manage the symptoms. There's a lot more freedom in strengthening yourself. For example, I was just talking, so at the Injury Society for Toronto, I did a talk for them on sleep yesterday. And a common problem brain injury patients have is PTSD and sleep issues. And
Oh,
so a lot of these people have a tough time with sleep because of nightmares and other reasons related to PTSD. And uh,
I apologize. I'll just stop
yeah,
it. PTSD, as in, can you elaborate that term?
oh,
Post-traumatic.
post-traumatic stress disorder.
Yes, please. Just for the readers, please
Right.
go on, please.
So this lady has been trying various medications and to help her sleep, but it changes your sleep architecture in a way
Um,
that tends to prevent REM sleep, which is thought to be really involved in memory consolidation, which helps with the treatment of PTSD. And we know for PTSD that psychotherapy is first line, medications is second line. But and everyone knows that, like in the medical community. However, it's just really hard for people to access these types of treatments. So that's where my interest has been.
yeah. And whenever you mentioned REM sleep, that is rapid eye movement sleep.
Yes,
And if you don't have, like from a very layman perspective, if you do not have that portion of sleep, because we sleep in layers, so
right.
there is a non-REM sleep, there is a REM sleep. If we do not have REM sleep, it affects our health in long term.
Yes. Well, like if you're not getting REM sleep, but then you're probably also not getting like deep stages of sleep also. Like you said, it works in
Okay.
cycles. So if you're not having a sufficient sleep cycle, then you will face the consequences of that generally, which can be like memory issues, cognitive issues, even
Okay.
cardiac issues, inflammatory issues, immune system issues, fatigue, mental health issues, and so on.
Oh, wow. Just for our readers interested in preventive health, are there any proactive steps they can take in their daily life to minimize the risk of concussion, whether they're athletes or not?
Um, well, I got four girls of my own, and one of the things I do is I just don't put them in sports where they can risk concussion. I know that's kind of controversial.
Hmm.
Some of my colleagues don't believe in that, but I don't really see the point. Like I don't unless they are like naturally gifted, like Messi or Ronaldo or something, and they gravitate towards the sport. I um I just put them in sports like running and swimming and gymnastics and things that have low chance of having a concussion. And then, just having some awareness of the kinds of injuries that can result in brain injury is really important because, they say an ounce of prevention is worth a pound to cure, right?
Hmm.
Um, and when I deal with patients, I often like take a history regarding how they injured themselves. So, for example, we get a lot of car accident patients, and when you hear the mechanisms of the car accidents, majority of the car accidents happen the same way. And so I'm more on guard. I wouldn't say I'm anxious, but I'm more like aware when I'm driving. And because of that awareness, I have saved myself and other people from several
Yes,
accidents, right? So I think
true.
that's the main thing is spending a little bit of time to know the kinds of mechanisms that result in concussions and then taking steps to prevent that.
Yeah, yeah. And in the post concussion, like health challenges in the post concussion syndromes that you have told us so far, it can be a journey. So what are some key mental or emotional strategies you encourage your patients to adopt to stay motivated, resilient, and focused during the recovery period?
So like this varies from person to person, but
Yeah.
in general, I find the patients who do the best are the ones who are the most relaxed. So, people who are more relaxed tend not to over focus on what they can't do and what they've lost. They tend to focus more on, okay, I'm here now today. What's one step I can take that takes me one step closer to the version of myself I want to be, right?
Okay. Yes.
And if they can just stay with that, they really move pretty quickly to where they want to go. So that I find that it's, and I remember remember Andre DeGrasse, he's like the most winningest Canadian athlete in the Olympic Games of all times. I met him after he won silver in 2016, and I was amazed because when I first saw him on the screen, he was standing next to Usain, and Usain's personality is really large, he's kind of larger than life. Everyone loved him, but I saw this Canadian, I never heard of him. And so he got my attention, and I noticed that he wasn't nervous. He looked very calm and relaxed. And sure enough, he performed amazing. He got a silver, right?
Yeah.
And so when I met him, that's what I want to ask him about is how did he stay calm like that? And what he told me, first of all, he's such a calm person.
Okay.
Even the way he speaks is so kind of relaxed and calm, which you wouldn't even imagine that he's fast, right? And then
Yeah.
uh, but he just said, you know what? He just focuses on his race, just the rhythm of his race. He doesn't focus on anything else, just the next step, the next step, the next step. And if he does that right, he's going to do all right. So even at that level, we're watching and we see them, and we're like, go, 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 go. We think that's what they're doing inside, but they're not. They're just
Yes.
after I spoke to him, I got the impression that he just goes somewhere else and he's just relaxed, as
uh,
weird as that sounds.
into his own zone and all.
Into his own zone. As far as he's concerned, Hussein's not there. That's the impression I got, you know. He's just
Fantastic.
there doing his thing the best he can, focusing on the next step.
Yeah, fantastic. You have been practicing medication for over a decade, having graduated from University of Toronto in 2006. I'm very happy to say that because I'm also a UF to graduate. So, what are some of the most significant changes, or or should I say advancements you have observed in the field of concussion management or behavioral medicine during your career?
Well, I think neuroscience has just been exploding, and so it's been informing a lot of our decisions, and it's been getting a lot of attention. And also, patients are getting more educated now, maybe because of social media and so on.
Mm,
So
true.
patients are not really satisfied anymore with just managing their symptoms. They want freedom to live their lives on their own terms. Um, and so this calls for a functional approach in getting people to perform better. I know when I was in medical school, like when they're talking about insomnia, you know, there wasn't much talk about cognitive behavioral therapy for insomnia, or when they're talking about brain injuries, there's really not any education about it and how to train people to recover. Now, they can't cover everything there, but it gets very little attention. And oh, I've seen this kind of change now where these type of treatments are getting a lot more attention.
I really like I really like the way you put it that the today patient wants freedom on their own terms and they want functional solution. I
Yeah.
really like the term.
Oh,
It's
thank you.
fascinating. You have captured the public feeling, the people's feeling in such a nice way. And just to unpack that idea, many of our readers are interested in adopting a healthier lifestyle. Drawing from your own expertise, what are one or two fundamental principles of health, whether it can be physical, mental, that you believe everyone should prioritize?
Yeah. Actually, can I go back to the last question just for a second?
Yes, please.
So that got me thinking because a lot of the strategies we're using now, even though patients' tastes have changed a bit and their goals have changed,
Yeah.
a lot of the strategies we're using are strategies that have been around for a long time, just they kind of fell by the wayside. Like, for example, you go back to the 70s, assertiveness training was first line and people were using it for a lot of things. And then it kind of fell by the wayside because CBT got a lot of traction. There were studies done to show that it's evidence-based, and everyone wanted what's evidence-based, right? And it kind of just fell by the wayside. But now there's like a revival of it because they're seeing that it tends to invest, it's multi uh, diagnostic, like it treats transdiagnostic, they call it. So it addresses many different diagnoses, but it's investing in brain function, right? I remember there was one patient once, he was depressed. And so I was taking a history, and it seemed to me that his main issue is that he wanted to get into dental school. And if he got into dental school, a lot of things, he'd be able to do a lot with that. A lot of things would change in his life, and he had a lot of dreams. Those are his desires. And so I was like, well, maybe that's what we should work on is just assertiveness um, and working on your communication skills so you can do better on the interviews. He had two interviews before, and both times he didn't make it. So he did line up a third interview, and we worked on that assertiveness training. And he got, and this is an old therapy, right? But he got in, and he felt that he practiced a lot these assertiveness skills. He got in. He felt like our work together was instrumental to that. Years later, he sent me an email telling me everything's great in his life. He's really happy. A lot of things have, he even said if I'm ever, he moved out of town and he said if I'm ever in town to stay with him. And so it's a lot of these therapies are around. They're just not, they don't have our attention right now because of political agendas and cultural reasons.
Mm. Now back to our that was a fantastic addition, by the way, and the story is really the incident you have just described. It's really inspiring. what will happen, so drawing from your own expertise, that what are one or two fundamental principles of health? It can be physical, it can be mental, that you believe everyone should prioritize.
Um, this is personal. Like I think if you ask anyone, everyone will say sleep, diet, exercise, and stress management. That's like what most people say, right? But in my opinion, if I had to pick one or two, I would say exercise, because I think if you focus on exercise, a lot of things tend to come with that. Like you tend to eat better, you tend to like sleep better, your mood tends to be better. So I think that's one. And two, again, this is personal, but I feel like spending time just to, love yourself and get to know yourself, what you like, what's important to you. Um, how do you want to invest in yourself? How do you want people to think of you when you're gone? Like these types of things people refer to as spiritual. I find this is really important
Mm.
to your health in general.
No, that's nice. That's nice because yeah, um, how this, like, I have a good relationship with myself, and I have a good understanding of myself. No, that's fantastic. That's a really nice way to put it. For individuals who might be, there can be our readers or viewers among them, there might be some people who are feeling lost or overwhelmed on their own health journeys. Maybe they're recovering, maybe they're suffering from something. What is one piece of encouraging advice you would offer to help them to take care of the first step towards the positive change? What is the first thing they can do
You
when
know,
they
I
when they
think,
feel overwhelmed? Yes, please.
yeah, I think I'll give you my personal story. So what got me down this road, by the way, of like treating people with functional approaches is I was always very athletic, and I had a bad injury, lumbar disc herniation, when I was in my 20s. This is almost 20 years ago.
Mm.
And um, it wasn't getting better, and it was like a year and a half. And I went from like 210 pounds to 170 pounds. Um, it affected my life in every aspect. And I saw doctors, and most of them told me, do physiotherapy, do these things. I did them, and things weren't improving. At that time, I wasn't a sports doctor. That's what got me into sports medicine. Um,
Okay.
so I so then I reached out to a professor named Dr. Stuart McGill at the University of Waterloo. He was a biomechanics expert.
Mm.
Uh, he helped me a lot, although we didn't talk that much, but he helped me a lot. And I was able to rebuild my strength and my biomechanics, my physiology. Like you see like all these weights behind you.
Yeah, yeah.
I can now kettlebell swing 48 kilograms, right? And I'm 45 years old, and I don't exercise that much. It's just because of these principles that I trained. I haven't had back issues since that time, like never. And I do everything now. So it was a permanent solution, right? So
Mm.
I think from my personal example, the two main things I would say is one, ask for help. And two, it seems kind of different, but the second thing is take accountability for your own health, because like Dr.
Yeah.
Stuart McGill is not going to fix my back, even though he helped me. At the end of the day, I got to do the work. I'm responsible for it. Um, I think those are the two main things I have to say about that.
Yeah. Fantastic. And that is truly an inspiring and truly encouraging, because ask for help and take responsibility of your own health. Fantastic. That covers a lot of ground. We are almost at the end of the conversation. So, our departing question is your dedication to continuous learning and improving clinical practices is evident. What inspires this ongoing pursuit of knowledge, and how does it ultimately benefit your patients?
Well, actually, I think that my last story is a perfect segue to this
Yes,
answer,
yes, yes.
is that like experiences like that changed my life.
Mm,
And I just want to share that with people.
mm,
I see the spirit of medicine as being a field that is dedicated to empowering people with the knowledge and the freedom to live their lives on their own terms. And I just want to be a part of that spirit.
Yeah. And what about in this relation? What about patients who have like an ongoing trauma? Like we live in a very hyper fast world, never enough time to do anything, that people working less and less sleep. So what about the patients who have had trauma and have unlocked new abilities like language skill or anything, or mathematical, etc.? What about them? Like how how they can deal with the past trauma?
Oh, like post-traumatic stress disorder?
Something like that. Yes, please.
Um,
When people had those.
yeah, you know, there's there are good treatments out there for
Mm,
this. So for post-traumatic stress disorder, there are several.
mm,
One is cognitive processing therapy,
mm,
and another one is prolonged exposure therapy. Again, even privately, those services are hard to source.
mm,
And that's unfortunate because a lot of people need help, but it's hard for them to get the services they need. But I'll give you another personal story. So I had an issue once. It had to do with the health of my eldest daughter,
okay.
and it was without going into so many details, it was like a dire diagnosis she had, and she had a very bad prognosis, and it affected
Mm,
me a lot. It affected my mental health, and I never had an issue with mental health before, and I don't think I even really understood it properly, even though I went to medical school. It's kind of
mm,
funny. That's how I got into psychotherapy, actually. And um, so for 2 years, I kind of avoided the issue and not consciously, I just wasn't paying attention to it, but it had an effect on my life. Like a lot of things
mm,
didn't go the way I wanted them to go. Relationships were falling apart and things like that. And one time, I was sitting there. I was my daughter now, the daughter with the issue. They said there was a 40% chance she wouldn't make it till her ninth birthday. And that was very hard for me.
mm,
And there was she was 2 years old. She was like playing in her little kitchenette, like the little toy.
mm,
And I was just sitting there, and I wasn't like the same person. And she looked back at me, and she didn't see her mom there, and she felt very insecure, and she started panicking as if I was some kind of abuser. And it got my attention because she's only two. She doesn't watch TV. She's not cunning. She's not trying to like be passive aggressive and make me feel bad. She just genuinely didn't feel safe around me. And I, at that point, I just switched. I instead of focusing on the problem, because people when they feel for you, they want to give you advice. You just got to do this, you just got to do that, and that kind of stuff. But instead of focusing on the problem, I really started focusing on what I do want. Given this is the situation I'm living in, what do I want? And this may sound strange, but I didn't want that experience to be our story. I didn't want to look back and lost an opportunity to bond with my daughter. Even I might not get this opportunity again, right? That's what the doctors were saying.
yeah.
Um, I didn't want to have any regrets and look back and say, I wasn't there for her. And so that's what got me to start working on myself and pushing through uncomfortable challenges that I was facing. And I came out the other end kind of like I don't know, upgraded, more adaptable, more flexible, right?
Mm,
And everything got patched up. And fortunately, although it wasn't contingent upon her success, but fortunately, my daughter was okay. Everything resolved, and we just celebrated her ninth birthday just this year. And it got me thinking of a saying by Mark Twain. He says, "I'm an old man, and I've known many a trouble, most of which have never happened." And I felt like I could relate to that. And I decided after that personal experience, I decided I'm not going to worry anymore. It's the biggest thief. It takes everything and gives you nothing. Now, if someone told me that when I wasn't ready to hear it, I don't think I would have been as welcoming of that piece of advice. So I
mm,
think, it's hard to give blanket statement recommendations to people going through trauma. I think there's like a journey and there's different phases, and
Yes.
sometimes they're ready for certain things and they're not. But if they can just focus on what they want, uh, and start working on that. And sometimes what you want is you have to be flexible. Like I can't do anything about whether my daughter lived or died, but I had some flexibility over the relationship I had with her. Terry Fox had no say over whether he was going to have sarcoma or not, or lose a leg or not. But, and many of us would say, well, now you can't run, but he did run, and he ran almost across the whole country, right? So
Yeah.
I think there is like a dose of acceptance that's required, but then there's a lot of opportunity as long as you can kind of highlight what you want.
Yeah. With that beautiful note and to most inspiring story over the session that you shared us with your, and thank you for sharing those inspiring stories to our readers, to our viewers. Dr. Taher Chugh, thank you very much for being with us today. Thank you very
No
much.
problem. My pleasure.
Yeah.
Thanks for having me.